Ever walked into a hospital and felt that sense of organized chaos? Well, what if I told you a silent revolution is underway that could change that experience forever? It's already happening in American hospitals, and it all starts with the rise of AI nurses. Picture this. You walk into an emergency room in 2025, the lighting is soft, calm, robotic assistants glide by, and a huge holographic dashboard on the wall displays every patient's vital signs in real time. We're talking heartbeat, oxygen levels, sleep patterns, and even emotional stress, all tracked with incredible precision. These aren't your typical nurses, or AI systems that work 24/7 without ever needing a break. They do and make calculation errors, and can monitor hundreds of patients at once using advanced sensors and predictive algorithms. Imagine an AI that can detect heart failure minutes before the first symptom even appears, just by analyzing real-time data. Or one that can measure your blood pressure with a simple camera scan and instantly alert a human doctor if something is wrong. This isn't science fiction. It's the direction we're headed. In some hospitals, humanoid AI nurse robots are already a reality. They deliver medications, guide patients to their rooms, and even assist in surgery. They can adjust for drips with microscopic accuracy and are programmed to speak in soft, empathetic voices designed to calm patients down. Above, ceiling-mounted monitors track breathing patterns while tiny robotic arms sterilize equipment at lightning speed. It's a vision of efficiency and precision unlike anything we've seen before. So, how is this possible? Behind the scenes, massive tech labs are feeding these AI systems millions of real-world medical cases. They're teaching them to read X-rays, spot infections, and predict which patients are at high risk for complications before they even happen. The goal is to create a support system that can handle the overwhelming demands of modern healthcare. Now, doctors and nurses on the front lines say these AI assistants aren't here to replace them, at least not yet. They see them as powerful tools to help manage overcrowded hospitals, grueling shifts, and the ever-increasing number of patients needing care. They're like an extra set of eyes and hands that never get tired. But this rapid advancement raises some big questions for all of us. What happens when the AI becomes more accurate, more tireless, and far cheaper than a human nurse? Will our hospitals one day become fully automated? Will our kids grow up trusting a machine with their health more than a person? This is the new frontier of healthcare in the United States. It's advanced, incredibly efficient, and has the potential to be life-saving. But it's also a little unsettling. The question is no longer if AI will transform our hospitals, but how far this technology will actually go, and what that means for the future of human care. What do you think? Let me know in the comments below. Thanks for watching, and don't forget to subscribe for more.